Well, hello again, and welcome to another episode of Around the Lake. And today we have Elisa Gillespie. She's with Proactive Motion. And Elisa, can you tell me a little bit about what is Proactive Motion?
Proactive Motion Physical Therapy is a physical therapy clinic. We're located in Huntersville. It is exactly how it sounds, Proactive Motion. We are all about getting people to start moving and stay moving, and really proactively think about their health. These are active adults that are just trying to help themselves before things get worse in terms of injuries, aches, or pains. We see adults, so anywhere between teenagers to older adults with orthopedic, sports medicine, and public health issues.
You know, I should know this, and I saw that you're both a massage therapist and a physical therapist. Is there a difference between the two?
Yes, it's very uncommon to find somebody that's both of those. So I've been a physical therapist longer. I've been a physical therapist for almost 17 years. I really enjoyed the manual therapy part of physical therapy, so I decided to go to massage therapy school as well. And that was about 8-9 years ago. So I am both of those. There is a difference. With massage therapy, it is pretty solely manual therapy, hands-on focused, but there's a lot of overlap. So it allows me to provide what people want, what people need. If they need a little bit more hands-on work, we can go more into the massage therapy, maybe a little bit more relaxation on the massage therapy front than the physical therapy front. So I would say there's a little bit of a difference, but a lot of overlap. So I think that's why I decided to go on and become both, so that I could offer a range of services.
And did I see you have another doctor on staff there?
Yes, so we just hired Dr. Lauren Craig. She has been a physical therapist, same amount of time, about 16, 17 years. She is a pelvic health physical therapist. So she treats women pregnant, postpartum, menopause, with all sorts of wide variety of pelvic health issues. So we're very lucky to have her on staff.
So if I went and had some surgery on a knee or a hip or something like that, and I got to have some physical therapy, there are a lot of physical therapists in the Lake Norman region. What sets your office apart from anybody else?
That's a great question. Yeah, so I have been in business for a little over 7 years. So I used to work in more of a corporate setting. So what sets us apart is really that the time that we spend. So it is one-on-one with the patient. It is, you are getting the same person, same therapist. They are seeing you throughout your whole course of rehab. They get to know you. They get to know your entire medical history. You're not having to review that. We are out of network with insurances, so we are not bound down by any insurance requirements, which means that I have patients that I see proactively for maintenance, maybe for years, and help them through their lifestyle, if they're making lifestyle changes, habit changes, whereas I don't have to cut them off at a certain time to meet any sort of productivity measure or anything like that. So it is, what's really sets us apart is the relationship building. I get to know people, I get to see families, and over years, and they come, they see me, they come back to me. So that's my favorite part about it, is really just, having those relationships for years with people.
Eliza, I know your office is in Huntersville. Where do you draw your patients from? I mean, how far out do they come
Oh, you
for your
that's a
services?
good question. My furthest one comes from 4 hours away,
Oh, wow.
because she moved and she couldn't quite find a therapist she was happy with. So she'll drive over once a month to see me. I also have somebody who comes from Boone once a month, I guess. So they draw. I actually have a large population that comes from Concord and
Mhm.
Kannapolis because when I before I formed my business, I treated in that region. So a lot of people have followed me and continue to follow me. But all around, lots of word of mouth with my business, especially in the early days. But see people from local neighborhoods here, Macaulay, Birkdale, Winfield, so a lot in the Lake Norman region.
Healthcare is a lot about relationships, and you hit on something. So my dentist, I have the same dentist, and he opened up his practice in like 1999. He's been my dentist since 2000,
Yeah.
and I'm very happy with him. My doctor was the same doctor since like 1998 until he left one healthcare provider, went to another, and I would have moved, but he became concierge care, and it's a
Yeah.
little. I'm not at the point yet where I need that level of
That level
service,
of care.
but it is
Hmm.
about relationships. If you find somebody you're comfortable with, you want to stay with them.
Exactly, exactly. They get to know you, trust you, um, and particularly with a modality that I offer called dry needling. Um, and it involves sticking people with needles.
Mhm.
um, they trust you to do that, so they're not apt to go to someone else once they trust you. That level of trust with sticking needles in you. So especially with the dry needling, I have people that trust me and return.
And you mentioned a variety of patients that you work with, whether it's from the sports world or families.
Mm-hmm.
Can you talk about who comes to Proactive for your service?
Who comes to Proactive, I would say the majority, or I would say is kind of that 30 to 55-year-old range, active runners, or they're doing workout groups or things like that that they want to continue to be able to do. I do see a lot of also some chronic pain, a lot of neck and back pain issues that maybe they've been elsewhere and it hasn't quite worked out, or they had to end their therapy and they can continue on with me. So I would say that's the biggest age range and also population that I see. So more like chronic pain, neck back pain, as well as lots of active strains, sprains, aches and pains.
Tomorrow, the chamber, we work with high school juniors in a program called Leadership Lake Norman. And we're going to be taking them to some of the government, so that town hall, fire department, police department. But I'm going to ask you, when you were 16 years old, did you know you wanted to go into the healthcare industry?
Yes. So a lot of physical therapists have their own physical therapy story, you'll find. So it's so I actually knew I wanted to be a physical therapist since about the age of 16.
Uh-huh.
I knew going right into college that was like the end goal. I did gymnastics when I was younger. I had a big gymnastics injury. I was in physical therapy for a long time. Um, I always knew I wanted to do orthopedics and sports medicine. That's never wavered. So I knew from like a very early age that that's what I wanted to do.
So are you still an athlete? Do you play golf, tennis, pickleball?
I know I actually enjoy I actually enjoy running
Uh-huh.
and strength training a lot. So I would say running's my most common. I was running a Couch to 5K group with the town of Cornelius last year. That's I was a Charlotte Marathon ambassador this
Oh,
past
wow.
year. So I'm really into the running world.
I know your office again, your practice is located in Huntersville. You live in Huntersville. What do you enjoy most about being in the Huntersville, Lake Norman region?
Huntersville, Lake Norman. So I have lived here. I actually moved from Long Island, New York, 12 years ago, and I've been in Huntersville for 11 years. And I live in the Macaulay subdivision, but I love, particularly with my neighborhood, I love the sense of community, lots of events. Our particular neighborhood is very much known for really celebrating the holidays big with all the lights and all that stuff. But I do love that it's people from a lot of different places move here. So I get to meet people that grew up here, from New York, from Ohio, from Florida, and I think that's what I love most and what's much different from where I grew up.
Yeah. Well, Eliza, we're going to have information about your business at the conclusion of this video, but I want to thank you for taking time to talk about Proactive Motion and
Yes, thank you.
what you're doing and sharing a little bit about that practice. We want to thank Joe Vagnone, who's a local business broker that makes this program possible. But thank you for being on the show today. I look forward to seeing you at a Chamber of Commerce event soon.
Yeah, appreciate it. Thank you, Bill.
Thank you, Eliza.